Matt, it's great to be with you again. Today's topic, I believe, is certification and complaint surveys. What happens? What do you do? Talk about the process and the implications.
Nathan, this is a really timely topic for senior care facilities and nursing homes in particular, because you are going to have a certification survey. Medicare, Medicaid, they are the primary payers in long-term care and senior care generally. And to continue participating in that program, you've got to pass your certification surveys. So they'll come in, they'll conduct a survey. There's a whole litany list of potential penalties that could be imposed if you're deficient, all the way up to from imposing civil monetary penalties to denial payments, all the way up to terminating, closing the facilities. But that's really a last resort. These nursing homes, these surveyors do not want to actually shut down a facility. And I can say that being a former attorney who used to represent a state survey agency, they recognize the risk of closing a facility on the transfer trauma on patients. And what they really care about is quality of care. And so, that's on the back end of these. But really what we want to talk about today and focus our time on is what happens when they walk in the door to conduct that survey, how you should respond to it. Nathan, do you have any thoughts on that?
I certainly do. And if you haven't already watched it, we do have a segment that we've done on crisis response. This is obviously, it counts as a crisis. But first and foremost, again, I'm going to back up just a moment and just say constant diligence is what you want to do. Perpetual diligence. You should be expecting that any day of the week, any time of the day, you could have an inspection. And so if you're just perpetually ready to go, that's the first step in compliance no matter what. But if the inspection's occurring, please call your counsel, please call your insurance company. We cover that in the other program. But once the investigators are there on site, be polite, be helpful. If you think that there is a document or a place or a thing that is going to sort of demonstrate what happened and answer the question, you want to show it. You want to be, don't just sit around and wait for them to ask you questions. If there's ways that you can be working with them sort of as a team to resolve the issue, that's the way to go. On the back end, though, after the inspector leaves, please also create a document of what happened. While it's really, really fresh, you want to make a memo with as much detail as you can about the questions that were asked, the answers that were given, any documents that were turned over, any places within the facility that they actually went to visit. You probably want to take photos just of things as they are. That is going to help on the back end as we are trying to put things together and respond to an investigation.
Nathan, I think you hit the nail on the head with that. I mean, I always tell facilities, look, you prepare for a survey, a certification survey, a complaint survey long before they ever walk in the door. It's how you document, it's how you prepare, it's how you train your staff. And so that when they're there and they're looking at something, they can look at the care plan and see that, no, you knew about this, you planned for it, you implemented it, your folks were trained. All right, an incident happened, but you did everything you could and you did everything the right way. That is your best protection, is to be prepared in advance. And then you're absolutely all right. When they're on site, they're going to talk to your staff, they're going to talk to residents, they're going to see things from a perspective, but maybe not the whole picture. And having it documented where you can provide them the documentation while they're there helps mitigate that pretty significantly, any risk. And then certainly working with them collaboratively to discuss any deficiencies to see what you can provide to get it reduced is critical. And these are all steps that I'm sure many of you are familiar with, but there are things that your counsel can certainly help you with. But Nathan, with that, I think we should probably wrap this one up.
I think so.
All right. Thank you, everyone.